Mr. Smith. I'm Sarah, your student PSW. How are you feeling this morning? Good? Okay. So, I'm just going to turn on your light here. And I'm going to be giving an abdominal assessment on you today. Is now a good time? Perfect. Okay, I just got to check your armband. Okay, so what's your first and last name? Jim Smith? Yep. And your date of birth? March 17th, 1936. Perfect. Okay. So, do you need to use the bathroom before we get started? No? Okay. I'm just going to put the head of your back to working height. Okay. And I got a pillow here for you. Okay, so I'm going to put your bed rail down. And I'm just going to put this pillow under your knees just so it's a little more comfortable for you. Alright. So we're going to start with just a general survey. Alright, so your eyes were spontaneously opening when I came in the room, so that's good. And do you know where you are? Yeah, St. Joe's Hospital. And do you know what month it is? March? Yeah. And the year? 2021. That's good. So you have a good appearance and you seem to be in a good mood and everything, so that's good. And for safety, your bed was down with your rails up and you did have your call bell within reach, so your safety was good. And now we're going to start with the inspection of our abdominal assessment, okay? So I'm just going to pull the blankets down and your Johnny shirt up a little bit, just exposing the abdomen. Alright, so do you have any pain on your abdomen? You're having a little stomach pain? Okay, we'll be sure to look at that. And do you have any flatulence or cramping? No? Well, that's good. Any nausea or diarrhea? No? And what about appetite? Has that changed, like an increase or decrease or anything? No, it's been about the same. And any allergies or food intolerances? No? Okay. And have you had medical history of abdominal pain before or any stomach issues? No, this is the first time, okay. And any issues with your prostate? No? And any heavy use of alcohol or tobacco? Just the occasional drink? Okay, well that's fine. What about fluctuation in weight? Has that changed at all? No, it's been about the same. Okay. And what about your bowel habits? They seem pretty good, pretty regular, alright. And when was your last bowel movement? It was last night? Okay, well that's good. Was it easy to pass for you? Yes? Alright. And what was the color of it? And was it formed or loose? It was formed, okay. And the color was just normal. And it didn't have any strong odors or anything? No? Okay, perfect. So what about your urinating? Is there any pain or burning when you void? No? Okay. And I'm just assessing your abdominal area. So your skin looks good. It's nice and pink. It doesn't look dried out or anything. I don't see any moisture on there. I'm just looking for scars or striae, which is stretch marks. Inflammation, no, that looks all good. I don't see any rashes or redness. Your umbilicus looks good. There's no drainage or redness or crustiness or anything. Well, that's good. And it's midline in the body. That's good. So we're going to start auscultating, which is listening to all 4 quadrants. Okay, I'm going to use my stethoscope and just warm it up a bit for you here. Okay, so because you were having pain in your stomach area, which is your left upper quadrant, we're going to start with your left lower quadrant and just work clockwise, doing the area with the pain last, okay? So I'm just going to listen for 1 minute to each of the 4 quadrants, starting with your left lower quadrant. Okay, and moving on to your right lower quadrant. Okay, your right upper quadrant. Alright, and last is your left upper quadrant. Just let me know if there's any pain. Okay. So I heard a good amount of vowel sounds, normal. Okay, so that's good. I heard about 5 to 30 vowel sounds per minute, which is the normal range. Okay, and if I didn't hear any vowel sounds, I'd have to listen to that quadrant for 5 minutes, so that's good. All right, and I noticed, yeah, looks good. Okay, so next I'm just gonna palpate the area. And I'm going to start with the left lower quadrant again, and again, just let me know if there's any pain. Okay, and I'm just pushing in 1 centimeter, not very much, just gently pushing in. And I'm just feeling for any lumps or masses or texture in the skin or pulsations, a change in temperature. Okay, moving on to the right lower quadrant. Okay. And the reason why we palpate the area after we auscultate is because palpation can stimulate the peristalsis, which is makes the vowel sounds. So the right upper quadrant. Okay, looks good. I don't feel any texture or anything. And last, just let me know when it hurts. That's tender there, is it? Okay. And I notice you're guarding a little bit, just tensing up your muscles, so I'll definitely include that in my documentation and record it off to the cover nurse. Okay. So now I just have to do a pain assessment. So can you just tell me about your pain? What does it feel like? It feels like sharp pain in your stomach, all right. And you said the area of your pain is in your stomach area, so that's your left upper quadrant. All right, and on a scale of 1 to 10, how would you rate your pain? 1 being no pain at all, and 10 being the worst possible pain. You've rated about a 5? Okay, well that's good. I'll definitely report that off to the nurse, cover nurse. And how is your pain? Is it continuous? Does it come and go? It's pretty continuous throughout the day? Okay. And does it affect how does it affect your daily activities? I guess if it's sharp pain, you don't want to get out of bed, no? And okay, it affects how you, affects your walking around the hospital floor. Okay, well that's definitely important, so we'll try and get this pain subsided and make you feel better, alright? Okay, so I'll pull your Johnny shirt back down and cover you up, so we're all done with this abdominal and pain assessment for right now. I'll just grab that pillow. Okay, and I just gotta put you back in a safe position. So I'll put your rail up, okay? Your bed is going back down to the floor, okay? And did you want your head up to watch some TV? Okay, perfect. Okay, so your bed's down to the floor. Your call bell's within reach. Alright, and do you need anything before I head out? No, you're okay? Do you want some water? No? Okay. So I'll be back in about an hour just to check up on you, and I'm gonna go report off to the cover and do my documentation, alright? Okay, have a good afternoon.